Good afternoon. I'm Dr. Rasta Aste. Now I'm going to discuss about the complications of spinal anesthesia and how we can prevent or treat that particular complications. In the previous videos, I have already discussed about the different techniques of the local anesthesias. Now here I am discussing about the spinal anesthesias complication. So, first complication is respiratory paralysis. So, that is the because of the hypotension and ischemia of the respiratory center. So, whenever we are using this particular kind of the spinal anesthesia, there is more frequently that leads to the respiratory failure or initial respiratory paralysis followed by the respiratory failure. So, how we can prevent that? By giving the oxygen supply and also maintenance of the BP. So those are the preventive measures by giving the more oxygen supply and also maintaining the BP by giving the IV fluids so that further it maintains the blood pressure and preventing the taking of the antihypertensive before going to the surgeries, that is also. Next, another kind of the complication is the hypotension. So it is due to the mainly the blockade of the sympathetic vasoconstrictor outflow to blood vessels, venous pooling, and also a decreased return to the heart, which all contributes to the more fall in BP, blood pressure. So these are the reasons. So how we can prevent the hypertension? By raising the foot ends overcomes the hypertension by and also this foot raising also promotes the venous drainage. Additional to these particular thing, we can even use the sympathomimetics, especially those with prominent constrictor effects on the vein like ephedrine, mephentyramine effectively prevents the and also counteracts the hypotension. So another kind of the complication is headache. This headache is mainly due to the seepage of the CSF fluid. We are getting the more complications like a headache. Then how we can prevent this particular headache? By using the smaller bore needles. So wider bore needle causing the, because when we are pricking that there is wider opening, so that leads to the further seeping of the CSF fluid. So when we are using smaller bore needle, so when we are pricking to the skin and into the particular CNS L3 L4 lever or into L3 lever, so because it is smaller, the seepage will be low. So that can prevent the headache. Next, another kind of the complication is cauda equina. Actually, in the previous slide, I have clearly mentioned about the complication and the prevention. The same way you have to write in an examination, side heading as a complication and detailedly explain the preventive measures. So let's come to the cauda equina syndrome. It is prolonged loss of control over the bladder and bowel sphincters. So it may be due to the traumatic damage to the nerve roots or chronic arachidinitis caused by inadvertent introduction of the antiseptic or particulate matter in the subarachnoid space. Particulate matter. So, the cauda equina may be due to the damage to the nerve roots or chronic arachidonitis It may be caused by the introduction of the antiseptic or particulate matter in the subarachnoid space. So that's why when we are using this, whether there will be a expertization is needed to not to prevent the damage to the nerve roots, and the antiseptics or the particulate matter, when we are doing the sterilization at that particular time, we have to clean it properly, remove the hair in removing the hair removal at the site of the action, at the site of the surgery has to be done, and we have to allow that particular antiseptic to be dried up so that that cannot go inside to cause any kind of the damage. Next one is the septic meningitis. Septic meningitis due to infection introduced during lumbar puncture, and this can be prevented by using strict aseptic precaution. If it is happened, the infection has happened, then treat with concern antibiotics, antimicrobial drugs, whatever which are required, needed for that particular condition. Another kind of the complication is the nausea and vomiting. It is due to the reflexes triggered by the traction on abdominal viscera. So how we can use these, we can prevent by pre-medication with the opioid analgesics, can prevent it, and also some kinds of the proton pump inhibitors or antiemetic drugs can be given as a pre-medication, or as a post medication if the complication occurred. So overall these are the main complications of the spinal anesthesia. So what are the contraindications of the spinal anesthesia, where we should not use the spinal anesthesia as a technique of local anesthesia? In the hypotension and hypovolemia, because they itself causing the hypotension. So when we further use this anesthesia, further hypotension can be caused. Uncooperative or mentally ill patients. So uncooperative patients, we cannot use any kind of the local anesthesias. Infants and children, control of level is difficulty. If there is any kind of the bleeding diathesis, if any raised intracranial pressures, or any vertebral abnormalities like kyphosis, lordosis, and etc., and the sepsis at injection site, because it further leads to further sepsis into that particular sepsis into this particular CNS, cause the further meningitis, all those complications. So that to prevent it, we should not use spinal anesthesia in this particular condition. That's all about the spinal anesthesias, complication, prevention, and management, and also the contraindications. Thank you.